Our next speaker is Dr. Halas, and they will speak about high-intensity facial muscle stimulation technology in combination with RF heating for facial rejuvenation and volumization, a retrospective study.
Hi, thank you.
Wow, you have multiple names today.
Yes, this is my real name, though, so I have a couple of disclosures. And as we are all aware, facial aging is a multifactorial process. We know skin, we know fat, we have wonderful devices like the one just presented, which can make some improvement on skin texture. But we also have the accompanying volume loss, for which we were always using fillers. The skin affects the soft tissue, but the soft tissue is not just fat, it is muscle as well. Can we make a change there? And then ultimately, when we have this loss of volume, this loss of structural support affects bone as well. Returning to the subject of high-intensity facial muscle stimulation and synchronized RF, we could theoretically have the enhancement of supportive structures and toning and elevating of the facial muscles. As well, because of the RF, we'll have collagen and elastogenesis in skin and connective tissue. So how does the HIFES actually work? We are creating supramaximal contractions of delicate facial muscles, and as we know, this is not impeded by botulinum toxin, thanks to the earlier talk. And for the purposes of these studies, we're focusing on the frontalis area, zygomaticus major and minor for the cheek, the major lifting muscles of the cheek, and risorius. Synchronized RF, as has been proven many times, delivers heat into the skin, which can counteract the loss of collagen and elastin. It also increases blood circulation, providing for a higher nutrient supply, and that, as we can see on the far right, the development of those new collagen and elastin fibers. So the hypothesis is, with using HIFES and synchronized RF for the targeted facial tissues, is will we be encountering volumetric changes because we are also stimulating that muscle. We are, as has been proven before by muscle stimulation technologies, we are getting both hypertrophy and hyperplasia. So it should be postulated that a combination of HIFES with the addition of synchronized RF for skin improvements should be giving positive effects, as we have seen in multiple different studies. And in this abstract today, I will be talking about combining and pooling retrospectively all of those patients together from the initial 5 studies. So the data from 43 patients were pooled together. All of the patients underwent exactly 4 treatments, identical 20 minutes, done on average 1 week apart. With the follow-up visits consistent for all patients in all study sites at 1 and 3 months. 3 of those patients, when pooling all the patients together, completed a non-mandatory 1-year follow-up where they did not have any additional facial treatments. And the device applicators was applied to the frontal muscles as described and both cheeks. So looking at that pooled 3D data, we can see at 1 month an equivalent of about 1 syringe per zygomatic area, and at 3 months that comes out to about to a syringe and a half. In the mandibular area, you can see here on the graph and also the 3D visualization that the mandibular area decreased in volume by, on average, about 1 milliliter. And just to specify, the radiofrequency was at 42 degrees and was measured consistently throughout the treatment, ensuring the safety of the procedure, but also that there actually was not penetration of the radiofrequency into the deeper tissues that would have a negative impact on fat. Here you can see an example of the 1-year follow-up, which is most intriguing because even from those 4 treatments, you can see that at 1 year there still is persistence of improvement in the zygomatic area. There is also additionally persistence of elevation of the brow and a decrease still along the mandibular area, so maintaining that jawline improvement. So in conclusion, HIFES and synchronized RF increases the tone of facial muscles, also has a skin lifting and tightening effect, and age-related volume restoration by facial tissue repositioning, decreasing along the mandible, increasing along the cheeks. This provides a foundation for further rejuvenation, can reduce our reliance on exogenous injectable fillers, was effective across young and older patients, and resulted, when you're looking in sum total, of 5.5 milliliters of facial volume change. And the AV system is concluded. So thank you.